Hi, I'm Dr. Brian Thornburg. I'm a board-certified pediatrician, and I've been practicing pediatrics for the last 20 years. I'm going to speak on coronavirus today. I've taken some time to research this because this is a new disease. We really don't understand how it's affecting people. So I've taken my time because I had to get an understanding of what's happening. So my assessment is that this is a legitimate concern, but I don't think it's as catastrophic as we think. We're doing a lot of protective measures to help limit the spread of this disease, but I want to go through some things that could help your family stay safe while this is tailing off, and also raise some of the concerns there are with the politics, the testing that's going on, but really to make sure that you're doing what you can for your family and for your loved ones. One of my patients said this to a father of mine in the practice. Said, "God has sent everybody to their room so they can think about what they've done." And there's some truth to that. What we can see has happened since people have been in their home with the home safety plan. Things are getting cleaner. The environment's cleaning up. We're not generating as much pollution. These are the Himalayan mountains. For the first time since World War II, you can see the Himalayan mountains from India. Here is Los Angeles a week before the city went on lockdown, a week into it, and then currently you can see the pollution is really cleaned up significantly. Here's a picture of Beijing or China from space. You can see the pollution around Beijing is significantly decreased just under a 2-month period from January to the end of February. A lot of good things are happening because of this home safety plans that we're on. But the most important thing is while we're home, we're connecting with each other. We're connecting with family again, we're connecting with friends. This is really what's going to help boost our immune system. When we're not stressed out, our immune system works much better. An example of this is summer camp. Kids are with each other 24 hours a day. They're sleeping in cabins, but they don't get sick. Nobody's getting sick because they're having a great time. Their immune systems are doing great because they're not stressed out. You put them in school, stress environment, they're around each other for a third of the time that they are when they're at camp, but they're sick all the time. For the last 3 weeks since people have been at home and quarantining, I maybe seen 2, maybe 3 sick patients during that time because people aren't getting sick. What I'm getting is more falling off their bicycle, broken bones, falling on the stairs, cutting their chin open. So what we're getting is this is a time to boost our immune system. It's time to recalibrate what's important to us, reconnecting with family and staying healthy so we don't get this disease. So let's get some perspective on the whole thing. So I'm a pediatrician, so I want to talk about kids first. 95% of kids worldwide have mild disease, and the statistics are even better for children within the United States. Here is a study that was done by the CDC and published in the Morbidity and Mortality Weekly Report, and we can see that of all the cases in the United States, only 1.7% of the cases are in children, yet children make up 24% of the United States population. So you can see that kids really are not getting this proportionally compared to the older people and adults. I've scoured the literature to find out how many children have died, because obviously getting the disease is one thing, dying is a completely another. We don't want to see anybody die. I could only find 4 cases of children dying anywhere in the world. The first one had complex medical history, had a bowel blockage, had been in the hospital for a month, and then passed away from COVID. Maybe it was COVID, maybe it was a bowel blockage, I don't know. The second one was a 12-year-old in Belgium. They are not certain. The newspaper reported that they weren't certain if there was a past medical history, so I can't speak if there was an underlying medical condition. Next one was a 13-year-old boy in the United Kingdom. Family reports that they did not believe he had an underlying medical condition. I find that to be interesting language to say you don't believe that your child has something, so I'm not 100% positive that child was completely healthy. And then the last was a 13-year-old girl here in the United States who had a long-standing history of complex seizures, and she passed away from COVID. But it could have been the seizure disorder as well, so I'm not quite certain. Bottom line is, kids really are not dying. If 4 kids out of all the children in the world have died from COVID, that's really not a lot of people. Again, we don't want to see anybody die, but this is really good news here. This is the incidence of death once you contract it, and also how infectious the disease is. So if you look here at the x-axis, this is how contagious it is, and if you go up the y-axis, this is how deadly the disease is. We don't really have a history with this illness, and we're still getting data points, so that's why you see this pink box. So the coronavirus contagiousness is somewhere in here and the deadliness is somewhere up in here. We don't really know. What we're seeing is approximately 3% death rate for those who contract the disease. That's what we've seen so far. Just to put this in perspective, chickenpox is more contagious than the coronavirus. Measles is more contagious. Measles is less deadly. Chickenpox is much less deadly. And you can see other forms of coronavirus, MERS and SARS, are more deadly and likely a little bit less to the same in its contagiousness. If we look at the New York Times, they've reported this is the incidence of death for those who have contracted the disease. You can see Italy topped the list at 12%, and Germany brought the bottom up at 1.6%, and the United States is sitting at 3%. The number of reported COVID cases is not very useful, though, because we don't know how many people who actually have the disease are being tested. So if only those who are showing up sick are being tested, then you're more likely to have a higher incidence of disease burden because your bottom number, your denominator, is not reflecting a larger population. Also, it depends what test is being done, how well they procured the sample for the test. All of that will influence whether or not this is valid data or not. This is a study from the University of Oxford in England through the Imperial College. They were looking at the number of infections and the impact on non-pharmaceutical interventions, and what they said was the estimate that the true number of people who have been infected with the coronavirus in the United Kingdom as of March 30th was somewhere between 800 to 3.7 million as compared to the number of cases that were reported of just 22,000. So you can see many more people are developing this disease but not having bad outcomes, not going to the hospital, not getting tested. So this is good news also. So the disease is not as severe as is being commonly reported. It is not as deadly as being reported, but it is very contagious. So the countries that are doing a lot of testing tend to have lower fatalities. Again, it goes back to that denominator. The more people that you test, the more people that you will identify as having the disease, the more likely you are to quarantine that person. It's called ring isolation. You're able to put them in a home. They won't infect other people. Also, the more people you test who you think might have the disease, that denominator number will be higher, which then reduces the number of people who will then have the disease and die, or have the disease and have a bad outcome, such as have to be intubated. Germany, which had the lowest number, had 1.6% incidence of death for those who tested positive. They are doing 50,000 tests a day, 350,000 tests a week. And they are reporting that what they're able to do with that is isolate those who have tested positive. So that's why they're having a much lower incidence rate of death. So the more people that you catch having the disease, even though they don't have symptoms or they have very few symptoms, the more likely you are to reduce the fatality. That's the importance of doing a lot of testing. So how are we going to keep the infection rates low? Let's look to Germany with their 1.6%. They're doing early and widespread treatment and testing. They also have plenty of ICU beds with intubation equipment, and the population is generally trusting the government and using the social isolation as well as the stay-at-home orders. That's also what we're doing here. We're advised to wear masks, we're advised to wear gloves, we should wash our hands frequently, use alcohol to clean our hands if you can't get to soap and water, we should boil our food well, so that if you get at the supermarket and somebody's coughed and it aerosolizes and it drops on your fresh vegetables, so you want to make sure that you're cooking your food well. Be careful about who you're coming into contact with. This is a picture taken by the emergency department, pediatric emergency department here at my local hospital, at North Collier Hospital, and they are saying please wear masks for them. They don't want to get sick, and the less likely you are to get sick, the less likely they are to get sick. And as I said, the CDC is now recommending that we wear masks when we're out in public. This is an article looking at the benefits of wearing face masks, and it says surgical face masks could prevent transmission of human coronavirus as well as influenza from symptomatic patients. We do have to be careful about how we're using the face mask, how we're using gloves, because I've been seeing people at our local grocery store, they're wearing their gloves, they have their face masks on, they get to their car, they don't take their gloves off, so anything they touched inside of the grocery store that may have had coronavirus is now on the gloves. Now they're inside their car, they haven't taken their gloves off, and they're touching everything. So I would presume that they'd want their car to be a safe environment. Now they're touching their cell phone, they're touching the steering wheel, everything is now contaminated. They might as well as not have worn gloves at all. And same thing with masks, is if you are using the same mask over and over and over again and you're touching things that could be contaminated and touching the inside of the mask, now you could be actually giving yourself the virus if you're not handling your mask correctly. So you have to think about your points of contact. You also have to have a plan in place when you leave public areas. The gloves should be put inside of a sterile bag before you get into the car or once you open up the car door, so you're not contaminating the inside of the car. They do not belong on the ground. You walk around and I'm seeing gloves and masks just thrown on the ground. Obviously those could be possible points of contamination. That's not the proper way to dispose of your gloves and your mask. Then also we have to talk to our kids about taking care of themselves. Parents are the biggest influence on the kids. Kids, touch everything. They touch their face. They're really not that clean, generally speaking. So we have to make sure that we're teaching them as well. At this point, because we're doing our best we can with prevention through using gloves and using masks, we want to make sure that those who could be at high risk, such as those who are immunocompromised, those who are elderly because they seem to be affected more than the younger people, they should self-quarantine, 100% self-quarantine. Have Uber Eats deliver food for them or Grubhub. They should have people deliver the food. They should really stay inside their house because we don't know how deadly this is. We're not understanding exactly who is having the worst outcomes completely. We're getting an idea. I'm going to talk about that a little bit later in the lecture. But I think if you are at potential risk for death, you should quarantine, let everybody wear the masks and gloves outside. You should stay inside and use your friends and family to help you stay 100% quarantined. So the good news going forward is I mentioned that the New York Times reported that there's a 3% incidence of death in the United States. I've used the numbers that are provided by the Florida Department of Health from Johns Hopkins, and I'm finding that the numbers are much, much lower than that. So here is for the state of Florida as of this morning. We have tested 143,000, almost 144,000 people. That's less than 1% of the Florida population has been tested. So those who are feeling sick are going to get tested because there's guidelines on who can get tested. Those who are sick, only 10% of those who feel sick actually have the COVID virus. So if you look at the next column down, the 15,234, only 10% of individuals who feel sick actually have the virus. The rest of them are having the cold, they're having a flu, they're just having some other kind of viral illness that's not COVID. The current number of people who are hospitalized of those who have been tested is less than 2%. You could see it's 1.4%. So those who are contracting the disease, less than 2%, just over 1%, are actually ending up hospitalized. So the severity of the disease is not as intense. It's less than that 3% that the New York Times is reporting. Also, those who have died from the disease, who have been tested positive, is 323 in the state of Florida, which is 0.2% of tested individuals, much, much, much less than the 3% that's been reported. So Florida fatality rate is at 0.2%, much less than the 3% that's being reported. If we look at the general population, not those who feel sick, but just anybody that's walking around, anybody that's living in Florida, anybody that's living in the United States, anybody that's just a member of the human race here on Earth, we are showing that very small chance of contracting the virus. Florida has, if you're just a general healthy person, you have a 0.001% chance of dying. If you live in the United States, a little bit higher, 0.004%, and globally 0.001. Again, this is different than those who tested positive. These are people who are healthy, just walking around. This is the probable incidence of death. So the take-home message is people really aren't dying from COVID. If you're healthy, Florida residents, 99.999% of people are not dying. Florida, 99.96%, globally, 99.999% of the global population is not dying from COVID. The infection is passing primarily among those who are asymptomatic or have very mild disease. An early study out of China shows that 85% of those who are infected are asymptomatic. So that's why it's important to wear the gloves out. That's why it's important to have the mask. That's why it's important that if you're in the severe risk category that you isolate, because we don't know who has the disease a lot of the time. So anyone in the high risk category should be quarantining themselves. So stopping and looking at the fact that people are not dying at the rate that is being portrayed in the media, is the U.S. plan making sense to stay at home, close non-essential businesses, isolation, social isolation? So again, let's look at Germany for this. The Chancellor said on March 18th that Germans should stay home as much as possible. They've closed restaurants. They've shut down non-essential businesses. They are more strict than we are here. 10 or less people can congregate together. In Germany, they don't want more than 2 people together. So they're really limiting the contact because of that 85% asymptomatic or mild disease transmission rate. So they're really limiting the number of people. But what we're seeing is people are still going out. Here's a picture from 4 days ago in Germany, in Berlin, at a park. You can see not a single person's wearing gloves or a mask. They're populating the park it looks pretty populous, but they're not gathering in groups larger than 2 people. And a lot of times you're just seeing one person by themselves. So they're doing a good job at following what the government is asking them to do, and it's really reducing the incidence of transmission and the number of deaths. So again, these are their plans to provide appropriate treatment and minimize the risk of death. And what this does is it catches more people who have the disease so they can isolate them, that ring isolation, and then that lowers the number of deaths on the paper. But we don't want to forget that there's a much larger picture here. Corona is just one source of death, and there are other things that are causing a lot more death. If we look here in the United States, 432,000 people have tested positive for corona as of this morning, and 14,808 people have died from corona as of this morning. If we look at the flu last year, 35.5 million people had the flu last year with 34,000 deaths. So we're not even on the same order of disease or death rate, but we're shutting down the economy. We're keeping people home. As I said, there's been some benefits with the cleaner environment, reconnecting and boosting the immune system, and also because we don't understand the severity of this disease yet. But I just want to make sure that we're not losing context of, are we doing the best thing that we can? Not only that, the other side of the coin, could we do better with these other diseases if we're doing this with corona? Also, looking at heart disease, 600,000 people die from heart disease every single year in the United States. Cancer kills just under 600,000 people a year in the United States. That's almost 1.2 million people dying from these 2 largely preventable diseases, yet we're not shutting down the economy. We're not altering lifestyle. We're not putting public policy in place to alter how people behave. And this is killing this many people a year. Corona's only killed 14,000, almost 15,000 in the United States, and we're making huge policy changes. So we might want to reconsider how we're approaching these diseases as well when we get out of the corona pandemic. So does the shutdown make any sense? It's questionable whether it makes sense. We've only had 15,000 deaths here in the United States as of this morning, but we're not shutting the economy down for things that are happening every single year. 61,000 people died from the flu 2 years ago. 1.2 million people are dying from cancer and heart disease. And I do a lot of work with abused children, and so I just want to throw in that 700,000 children are abused each year, yet we're not putting public policy in place to alter any of these, and maybe we should be. So why not? COVID is an unknown. Why are we putting public policy in place right now? Because it's an unknown. COVID, we don't know what the catastrophic potential is here, but the data is showing that this is not the viral ice age killing off all the dinosaurs, killing us all off like we thought it was going to be. So, but fear is largely at play here. Fear is not logical. So this is an emotional play, and we're starting to gather more and more data. I heard today that the curve is starting to flatten, which means that less people are getting infected, which is great news. So we want to start moving out of the understandable, the emotional period, and move into the logical period. So let's turn fear into reasonable action plans with information and treatment. So let's start to look at the virus a little bit. If you're exposed to somebody that has the virus, it takes 2 to 14 days to come down with symptoms, an average of 5 days from the time that you're exposed. There are some outliers that can go out to 27 days, but that's rare. Most people are going to show up in 5 days. The Japanese investigators found that this could sit on an appropriate substance outside of the body and live. The virus can live for 17 days. They found it in the cruise ship Diamond Princess, which was out in California, 17 days after the cabins had been vacated. Here's a chart showing how long coronavirus can live on different surfaces, as well as at different temperatures. The ones I want to point out are 24 hours on droplets. So if you cough, you can send droplet with coronavirus. It can live up to 24 hours in that droplet. And then down here on wood and stainless steel, we see 24 and 48 hours. Alcohol and bleach kill it rather quickly. Washing your hands can kill it rather quickly. So we want to make sure that we're aware of where we are, what we're touching, and how long this can live in the environment that we're in. So the virus can also spread fecal-oral. Say I have the illness, I cough, the mucus comes up, it has the coronavirus, I swallow it down, it goes to my intestines, I go to the bathroom, I don't wash my hands, then I go shake somebody's hand. Now that coronavirus could potentially have been on my hands from having gone through my GI tract, on my hand, and on to the next person. So we have to make sure that we're using good hygiene all the time. And it just doesn't go with coronavirus, that's with a lot of other illnesses as well. There's a question whether or not there could be vertical transmission, which is a pregnant mom to a baby. There's some conflicting research. Here's two articles.